after this media availability, and it will be available on the Anchorage Health Department and Office of Emergency Management Facebook pages this afternoon. Thanks again. This is Chelsea Ward-Waller, and I'm going to hand it off to Dr. Janet Johnston, the Anchorage Health Department epidemiologist. Janet, please go ahead.
Thanks, Chelsea. And I'll just start in on the report from the Health Department. So as of yesterday, there were 6,005 confirmed cases of COVID-19 in the municipality. This includes 5,777 Anchorage residents in and out of state and 228 non-residents testing positive in Anchorage. There have been a total of 41 COVID deaths among Anchorage residents, and unfortunately, this is an increase of 3 over last week's report. Last week, there were 746 new cases reported. This is a 40% increase over the number of new cases reported the week before. And 20 of these new cases were from non-residents, including 12 seafood workers and 1 airline pilot. Notably, over the last 10 days, there have been 854 new cases. These are the cases that are still considered to be within their infectious period. And there have been reports that we're only detecting 1 out of 10. The estimate is we're only detecting 1 out of 10 actual COVID cases. So this would imply that we have approximately 8,500 infectious individuals within the municipality. If you have tested positive or you're experiencing symptoms, please stay home and isolate from others in your household for 10 days. This week, for the first time, we've gone above 100 new cases per day. So based on onset date, we're averaging 102.2 cases per day, which is a significant increase over the week before. And the current case rate per 100,000 population over the last 14 days is 30.15 per 100,000. This is 3 times the state's high alert level of 10 new cases per day per 100,000. The percent of tests that are coming back positive was 4.2% this week. This is a decrease from the 5.0 that we reported last week. While this measure has gone below 5%, it remains higher than we've had earlier in the epidemic. And this higher percent of positive tests suggests that we're not testing enough people to find all cases. So again, I encourage people to get tested if they've been in a crowd, if they've been in a public place without a mask and have symptoms, or have had known contact with individuals who have tested positive. Our current hospitalizations as of yesterday included 33 COVID cases and 9 persons under investigation. 11 of our recent cases, those confirmed within the past 10 days, are age 85 or older, and 23 are between the ages of 75 and 84. Approximately 20% of people in this age range who test positive for COVID will end up being hospitalized. And over the past week, our average hospitalizations have been 25 hospitalized cases and 15 hospitalized PUIs. With the increasing case counts, we continue to be concerned that hospitalizations will be increasing in the coming weeks with the ensuing need for ICU beds and ventilators. As of yesterday, we had 20 ICU beds available at the 3 main hospitals in Anchorage. And the hospitals continue to report that they're tight on bed availability and staffing. The current effective reproductive number in Anchorage is approximately 1.15. As we've explained before, when the reproductive number is over 1, that means that the epidemic is still increasing. So with this reproductive number of 1.15, we're projecting cases a week from now to be at approximately 136. We're also estimating that the current number of new cases per day will double in 25 days. That means where we're now averaging 100 new cases per day, 25 days from now, we would expect to be averaging 200 per day if nothing changes in terms of the reproductive rate. We do find that most healthcare providers and first responders can achieve sufficient PPE, but still not through the normal channels. And we are seeing a small increase in the average daily testing counts over the past week. The average turnaround time is similar to last week. The commercial labs are reporting 2.3 days for testing turnaround, the state public health lab 2.2, and facility locations 1.8. In terms of public health capacity, we had 461 new cases opened in ComCare, which is the system that we're using for case interviews and contact tracing. Over the past week, 407 of these completed an interview, 4 more agreed to an interview, and 10 were unreachable or refused participation. And we still have 40 that we need to outreach to. We also currently have 150 Anchorage contacts who have been registered in the past week, who we still need to reach out to for their first contact. Importantly, the most common known or suspected exposure among Anchorage cases opened in the past week has been household members. That's followed by employment and social events. Although we see individual identified outbreaks, I really want to stress that where we're seeing the most transmission is among households or among gatherings with family and friends. So while there are identified outbreaks, it's really that the virus is everywhere, and we need to all be careful and practice universal protections in order to bring down the transmission. We are still seeing sporadic cases associated with outbreaks in the homeless shelters and supportive housing locations in proximity to those shelters. As of yesterday, a total of 313 cases had been identified in this population. 19 of those cases were in the past 10 days and are therefore still considered infectious. Overall, we've had 20 cases hospitalized since the beginning of the outbreak, and 3 have died. We also continue to see cases in assisted living facilities and among sports teams. So new cases during the past 7 days, have been 69 or higher every day, and we peaked at 142 new cases last Saturday. So we want to stress that the virus is transmitting quickly throughout our community, and it's important that the public wear masks and practice social distancing whenever they're outside their home. Thank you. That's our report.
Thank you very much, Dr. Johnston. With that, I'm going to pass it over to Dr. Tom Hennessy with the UAA College of Health for some information about modeling and ICU bed capacity. Tom, please go ahead.
Thank you. Can you hear me all right? I'm going to report on the latest projection for hospital bed capacity in Anchorage under the current situation we have. Hospital beds have been one of the primary concerns of the COVID-19 epidemic because of the ability of the virus to spread very quickly and to overwhelm healthcare systems. And we saw this early on with the places that have very extensive and modern healthcare systems, such as New York City and Italy, where physicians had to make unfortunate choices about what patients would care and who would not. So preserving our healthcare capacity has always been a major goal of our efforts to control the COVID outbreaks, and something we've been tracking extensively in Anchorage since last spring. One of the tools we use to do this is the CDC's COVID Surge tool. It was developed by CDC that allows us to use local data to make projections about future hospital beds needed for COVID patients. The inputs into the model include the population of Anchorage, the total number of COVID cases we've had, those that have occurred over the last couple of weeks. We also include available hospital beds, ICU beds, and ventilators, and we input local information on the proportion of COVID-19 cases that need to be hospitalized, the proportion that need ICU care, and that will need a ventilator. And finally, we use our current reproductive number, which, as Dr. Johnston said, is a measure of how many cases on average each person with COVID-19 will subsequently infect. And the current estimate we used for this model was 1.12, and we used a range of estimates from 1 to 1.3 to give an illustration of potential different scenarios. So I'm going to share my screen now and show you the outcome from the model we ran yesterday on ICU bed capacity. And so this graphic is 4 different scenarios for intensive care unit beds. Just to orient you, the x-axis on this is just a calendar from October 15th of this year, going out a full year. The dotted red line represents the unoccupied staffed ICU beds in Anchorage currently. This number is 22 today. And each graphic, the height of that shows the number of beds projected to be used over time. The current estimate of the reproductive number is shown in blue, and that estimate indicates that we may exceed our ICU bed capacity by around January 1st, or about 11 weeks away from now. 2 other scenarios that include higher rates of transmission include the gray line with a reproductive number of 1.2 and the yellow line with a reproductive number of 1.3. That's about where we were at the end of July in terms of our reproductive number. And those estimates show that we could overwhelm our ICU bed capacity in as soon as 5 weeks from now. The good news, if we were able to reduce transmission just by 10% and bring the reproductive number down to 1, we would stop the growth of the outbreak and we would not exceed our ICU bed capacity, our hospital beds, or our ventilator capacity. So just by a 10% improvement in transmission, 10% improvement in wearing masks and in avoiding gatherings and in washing our hands, 10% more people who are infected who stay home under isolation, we can save our healthcare system from being overwhelmed and reduce the growth of this epidemic in Anchorage. So that's my report. Be happy to take questions later. Thank you.
Thank you, Dr. Hennessy. With that, I'm going to pass it over to Dr. Bruce Chandler, the medical officer for the Anchorage Health Department. Dr. Chandler, please go ahead.
Thank you. First, I think I'll begin. I'd like to thank the municipality and the people of Anchorage for the many hard decisions and determined efforts everyone has made to save lives and to protect Anchorage's many people at high risk of severe illness. COVID continues to spread widely, both here and now elsewhere in the state. We've had recent cases in a variety of locations: sports teams, businesses, assisted living facilities, shelters, churches, and medical and dental practices. In the last 2 weeks, 1,417 people in Anchorage have tested positive, 182 are school-age children. The number of people who have died of COVID continues to increase. In 32 days, some kids, teachers, and staff will be returning to school. So let's get ready. We've got work to do. For parents, some homework. It may be challenging for kids to adapt to a structured school routine after many months at home. Help them prepare by practicing putting on, wearing, and safely removing face coverings, demonstrating physical distancing and giving kids a distancing reference, like a hockey stick or a broomstick, reviewing with them how and when to wash hands, and teaching them about COVID-19 and how these steps help prevent the spread of this virus. Some homework for the rest of us. We all have a role to play in lowering transmission to protect those of us at risk of severe illness and making it safe for schools to reopen. Some core public health practices will help the entire community. Stay informed, be prepared, and follow public health advice. Get credible information about COVID-19 from reliable sources. Continue to think ahead about what you will do if you become sick or if someone in your family becomes sick and needs care. Talk to your family, friends, and neighbors about what you are doing to stay healthy and prevent the spread of COVID-19. Continue to practice good hygiene to lower your chances of getting the virus or spreading it to others. Stay home and away from others if you are feeling ill. Get tested. Keep practicing social distancing. With widespread COVID in Anchorage, assume anyone outside your home may be infectious. No gatherings are safe. Avoid gatherings and stay home, especially if you're at high risk or if you work or live with people at high risk. Avoid non-essential travel and trips out of your home. Wear a face covering except when your face is underwater. There are interesting reports this week of widespread transmission among members of a hockey team in Florida and a spin studio in Hamilton, Ontario. Stay away from people who are sick. And finally, these are stressful times. Some of us are coping, some of us are struggling. Please watch out for yourself, your kids, your family, and your neighbors. Don't hesitate to get help. Thank you.
Thank you very much, Dr. Chandler. And I'm about to hand it over to Heather Harris, the director of the Anchorage Health Department. But before I do that, could the person on the phone with the last 4 1793 please let me know who you are?
Yes, that's Dean Gates. It's my interpreter. I'm watching. She's just signing for me.
Perfect.
Thank you.
Thank you so much, Dean. All right, Heather, please go ahead.
Absolutely. Thank you so much. I'd like to highlight some of the public health recommendations that we have here at the Anchorage Health Department. And the first one is around masking and 6-foot distance. We really want to highlight and continue to communicate the important recommendation around masking and maintaining a 6-foot distance. And having those two things at the same time is incredibly important. We recommend that everyone over the age of 2 is wearing a mask at any time they're around non-household members. That could be in any indoor setting other than your own home. It could also be inside your own home when others who are not residents of your home are present, such as family or friends, or those providing services such as cleaning or childcare or repair to your home. It also, the recommendation is also true at any gathering outdoor, whether it's public or private. That could include sporting events or barbecues, birthday parties, picnics, holiday activities, any of these similar activities where non-household members could be present. It's also true for outdoor non-gatherings where 6-foot distance cannot be maintained. This could be running or biking on a trail or street without a mask. It's where the 6-foot distance cannot be maintained. This also ties into when individuals are doing sporting activities. There is an increased risk of transmission when exercising indoors. As Dr. Chandler just shared, there was a recent example in Canada around a spin class where they had reported adhering to many mitigation factors and they still had transmission. 6-foot distance is not going to protect you in these types of environments. We highly, highly recommend greater than 6-foot distance, at least 6 feet, and wearing a mask. We have recommendations to gyms, health clubs, and organized sports to modify their practice to include masking, especially during group exercise and during group athletic competitions and practices. I'd also like to take a moment to talk a little bit about the upcoming holiday we have with Halloween. Some of our favorite traditional Halloween activities can be at higher risk for spreading COVID-19. Specifically for kids, these high-risk activities include traditional trick-or-treating or trunk-or-treat events. And for everyone, we're especially concerned with crowded indoor spaces like costume parties or haunted houses where people might be close together and potentially screaming. As people think about how they're going to celebrate the holidays this coming fall, we encourage you to stick to within your household or small social bubble for outdoor activities. For Halloween in particular, you could potentially carve pumpkins outside with friends, have a Halloween-themed scavenger hunt, or host an open-aired costume party. And if you are going to trick-or-treat, please think about how to be creative. Consider using a Halloween-themed cloth mask to ensure good, safe fit. And also think about one-way options with individually wrapped goodie bags lined up for kids to grab and go at the end of a driveway. Next, I'd like to share a little bit about the recent release of the CDC recommendations regarding the persons experiencing homelessness. There were 3 main recommendations from the CDC HUD visit. The first one was forming a multi-agency task force. That initial task force has been brought together and is being led by a HUD technical advisor, and we're meeting weekly to implement the recommendations. The group includes state and federal local agencies, all with subject matter expertise. The second was around improving isolation and quarantine facilities. We have implemented the addition of additional food selection, snack, and coffee to encourage and support the residents of isolation and quarantine to stay in that facility. And we continue to work on additional services such as behavioral health or mental health supports that might be needed. The third recommendation was around expanding non-congregate shelter options. And we're actively pursuing non-congregate shelter locations specifically for those that are most vulnerable and identifying who those individuals might be. My final remark is really around just COVID reminders in general, and to say thank you to the thousands of residents that continue to be committed to staying informed, resourceful, and prepared as we navigate through these challenging times. Thank you for continuing to wear a mask, socially distance, and wash your hands.
Thank you, Heather. With that, we'll turn to questions from the press. Excuse me. First up, we have Dave Laval with KTUU. Dave, if you have a question, please go ahead.
Yes, I do. Thank you very much. Just want to make sure that you can hear me first.
Yes, we can hear
Yes, you can. Okay, great. This is regarding the travel mandate released by the state yesterday. Is there any consideration to changes to the city mandates to match what the state announced yesterday?
We are evaluating options around the emergency orders on a regular basis and analyzing next steps within that process. At this point, I don't have additional information regarding travel, specifically around travel mandates.
Thank you. And just want to let everybody know, I know we only have 5 minutes left. I'll do my best to make sure we get a question from each reporter, and we'll see what we have time for after that. From the Anchorage Daily News, we have Annie Berman. Annie, if you have a question, please go ahead.
Yes, I do. Thank you. This question is for Dr. Hennessy. In terms of ICU capacity estimate, which of those 4 scenarios that you lined out are most likely at this point based on current predictions? And how soon would we have to decrease transmission by 10%?
Thanks for that question. I think the most likely scenario is that current reproductive number estimate of 1.12, which has ICU bed capacity being potentially exceeded around the first of the year. That's about the level of the reproductive number that we've been at for the last week and a half or so, and that seems to be a pretty steady trend. However, we have seen it increase rapidly in past months, and that's why we modeled 1.3, because that's about where we were in the middle of the summer. And so that there is concern that we could increase transmission and be in that kind of scenario. I forget, there was a second part of your question.
Yeah, you talked about decreasing transmission by 10%, I think, for the first scenario. How soon would we have to do that?
Yeah, that model assumes that we decrease transmission by 10% today. It probably wouldn't happen that quickly, but still, I think the net effect, if we were able to improve mitigation practices and people were to adhere to them more carefully as the recommendations from the other presenters, we could see a decrease in the reproductive number fairly quickly, and we could then preserve healthcare capacity. So it doesn't have to happen overnight. Past changes when we had a mask order in place and others showed that it took about a week and a half to 2 weeks for those to become effective. And so I think that would be a reasonable time frame, and we would still preserve intensive care unit capacity if we could reduce transmission by 10% over the next week and a half to 2 weeks.
Okay, thank you.
Thank you. Next, we have Scott Gross from KTUU. Scott, if you have a question, please go ahead. Scott, are you muted? All right. Next, we have Tegan Hanlon from Alaska Public Media. Tegan, if you have a question, please go ahead.
Hey, thank you. Yeah, I had a question about schools. Yesterday the Anchorage School District announced it was planning to bring younger kids back to school next month. And I think there's a lot of questions about, is that the right time to start bringing kids back into classrooms? And I'm curious what the Anchorage Health Department's answer is to that question, given the state of coronavirus spread in Anchorage, the projections, is November the right time to reopen classrooms?
We recognize the challenge that the school district is trying to work through, and navigating the balance between or to take into account really what's happening within our community around COVID spread. And we recognize that COVID is going to be with us for quite some time. And so we are working with the school district to figure out the right slow progression and return back to school in a controlled and safe manner. I think it just goes back to the fact that there's no easy answers about how to do this. And so here at the Anchorage Health Department, we are looking forward to the continued collaboration and connection with the Anchorage School District to do that as safely and as controlled as possible.
Thank you. Next, we have Paula Dobbin from the Anchorage Daily News. Paula, if you have a question, please go ahead.
Yes, I had a question about the recent CDC report that came out with recommendations about the public health response to the homeless community vis-a-vis COVID. One of the recommendations was that the city separate the isolation and quarantine facility that's a downtown hotel. I'm just wondering where that stands. And then also it found that among the cases of COVID in the homeless population, 41% were Alaska Native residents. And I was wondering if somebody could address the reasons why that might be.
So I'll start maybe with the recommendation around separation of isolation and quarantine. We are working internally here at the municipality and with the continued support of CDC and HUD guidelines around how to do that most effectively. We recognize that we do need a separation between isolation and quarantine, and what that looks like and how to make that as effective as possible, given other recommendations within the report around wraparound services or case management support. Those things have to work in concert. And so we're working at how to implement those strategies as effectively and efficiently as possible and as quickly as possible. So we continue to work through that and figure out what the right practice might look like, and really rely on that task force as well of partners as we make those decisions and move forward. As far as the outbreak and the demographics around that, I can say that we have seen it to be true with COVID positive individuals that it is disproportionately impacting some populations of people. And so we take that data into account and figure out how to make appropriate steps forward to reduce the transmission of COVID appropriately.
And I'll just add that unfortunately the Alaska Native population is overrepresented in the unsheltered population across the city in general. So I think that the percentage that we're seeing in this outbreak is, I haven't run an exact analysis of it, but it's consistent with numbers that I've seen for the population that this outbreak is experiencing. So I don't think there's anything else going on there.
Thank you. Scott Gross, if you have a question, please go ahead with KTUU.
Yeah, thank you. I think I'm a little late to the party. I think I missed the beginning of this, but can you explain the reasoning and the backing that you have for the Anchorage School District in allowing students to go back pre-K through second grade, the importance, the emotional support that those kids need at that age, and even though the numbers are rising, why you feel that is a good step in the mitigation plans that are in place to make the community safe with that return?
We really, at the health department, appreciate a slow approach that the Anchorage School District is taking and a more phased approach to a return to school, and recognize that the school district is really trying to put some of that emphasis and attention about who returns back to school for those most vulnerable and of need of in-person interaction. And so we recognize and have been working with the school district about what their approach is to move forward, and are supportive of this slow, controlled, safe return of particular students as this phased approach back to school unfolds for the school district.
I might just make a comment, just as a pediatrician. It's important to remember that if we don't learn to read by the time we enter third grade, we never catch up. And it's a critical phase in these kids' lives to be learning how to read. So I know the school district is balancing. It's not going to be totally safe. As we've seen with the sports teams, there's going to be some COVID activity, and day by day, they're doing everything they can. And I think it'll help by limiting, not fully opening elementary schools, but opening to some a segment of that population, so you have more space to spread kids out. They're taking every step recommended to try to maintain physical distancing, and kids and staff and teachers all wearing their face covering. It's not going to be perfect, but I think we have to weigh the risks of the COVID against the risks of kids not learning to read. It's important to at least make the effort to get kids back into school, and hopefully successfully.
Mm-hmm.
Thank you all. And thank you all for your time today. Heather, would you like to say any closing comments before we end this media availability?
Mostly just a thank you again to the community for continuing to stay informed and make good choices about individual behavior. And we recognize that the majority of people in our community are wearing a mask and maintaining physical distance and continuing to wash their hands. And so a big thank you to the Anchorage community for continuing to stay vigilant as we navigate these difficult times. And a thank you to the media for participating and asking great questions, and just continue to look forward to sharing good information with our community. Thank you.
Thank you, Heather. And just a quick reminder that this recording will be available on the Anchorage Health Department and Office of Emergency Management Facebook pages later today. Thank you all. Have a great day.